Do you have trouble sleeping? You're not alone. In this vast universe of ours, millions grapple with the elusive pursuit of quality slumber. Today we delve into the labyrinth of sleep disorders. We'll explore the most common sleep disruptors, their origins, and how they affect our lives. From the restless nights of insomnia to the mysterious world of narcolepsy, we'll uncover the secrets of these nocturnal nuisances. So, sit back, relax, and let's dive into the world of sleep disorders. Insomnia, a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. It's like being trapped in a frustrating cycle of restlessness and fatigue. There are two types of insomnia: acute insomnia, which is brief and often happens because of life circumstances, and chronic insomnia, which disrupts sleep at least 3 nights per week for at least 3 months. The symptoms of insomnia are as varied as the people who experience them. These may include difficulty falling asleep, waking up frequently during the night, waking up too early, not feeling refreshed after sleep, irritability, depression, or anxiety, and even difficulties with attention, focus, or memory. The causes of insomnia can be complex. They may include significant stress, emotional or physical discomfort, environmental factors like noise, light, or temperature extremes, certain medications, changes in the body's natural sleep-wake cycle, and even certain medical conditions or sleep disorders. Insomnia's effects can be profound. It can lead to fatigue, mood disturbances, decreased performance in work or at school, and can even contribute to serious health issues like heart disease, diabetes, and obesity. But there's hope. Treatments for insomnia range from behavioral therapies to medications. Cognitive behavioral therapy for insomnia, or CBTI, can help you control or eliminate negative thoughts and actions that keep you awake. It can also help you develop good sleep habits like maintaining a consistent sleep schedule, engaging in relaxing activities before bed, and creating a comfortable sleep environment. In some cases, medication may be recommended. Over-the-counter sleep aids, prescription sleep medications, and even certain antidepressants can help. But it's important to remember that medication should always be used under the guidance of a healthcare professional. Lifestyle changes can also make a big difference. Regular physical activity, a healthy diet, limiting caffeine and alcohol, and managing stress can all improve sleep. Remember, everyone has an occasional sleepless night, but if you frequently have trouble sleeping, contact your doctor. Sleep apnea is another common sleep disorder where your breathing repeatedly stops and starts during sleep. This interruption in breathing can occur a few times or hundreds of times in a single night, leading to a range of health issues if left untreated. The symptoms of sleep apnea can often go unnoticed, as they typically manifest while you're asleep. They include loud snoring, gasping for air during sleep, waking up with a dry mouth, headaches in the morning, and difficulty staying asleep. It might be a partner or family member who first notices these signs. The causes of sleep apnea are varied. The most common form, obstructive sleep apnea, occurs when the muscles in the back of your throat relax, narrowing or closing your airway as you breathe in. Central sleep apnea, on the other hand, happens when your brain fails to send proper signals to the muscles that control your breathing. Sleep apnea, if left untreated, can lead to a number of health complications. These include high blood pressure, heart problems, type 2 diabetes, metabolic syndrome, and complications with medications and surgery. Moreover, sleep apnea can also lead to poor performance in everyday activities such as at work and school, and even increase the risk of accidents. Now let's talk about potential treatments. Mild cases of sleep apnea can often be addressed through lifestyle changes. This might mean losing weight if you're overweight, quitting smoking, avoiding alcohol and certain medications, or changing your sleeping position. For more severe cases, medical interventions might be necessary. These could include continuous positive airway pressure, CPAP therapy, where a machine delivers air pressure through a mask while you sleep. There are also various types of oral appliances designed to keep your throat open. In some cases, surgery might be required to remove tissue or correct abnormalities. Remember, sleep apnea is not just about snoring or feeling tired. It's a serious medical condition that can lead to long-term health problems. If you're experiencing the symptoms we've discussed, don't ignore them. Sleep apnea is a serious medical condition. If you think you might have it, please see a doctor. Restless leg syndrome, or RLS, is a disorder that causes an uncontrollable urge to move your legs, usually because of an uncomfortable sensation. It typically happens in the evening or nighttime hours when you're sitting or lying down. It can lead to issues with daytime sleepiness, irritability, and concentration. Now you might be wondering, what does this sensation feel like? People with restless leg syndrome describe the sensation as itching, crawling, pulling, creepy crawly, tugging, or gnawing. It's not a muscle cramp or numbness. It's more about this uncomfortable sensation deep within the legs. So what causes restless leg syndrome? In many cases, doctors don't know the cause. However, they suspect that genes play a role. Nearly half of people with RLS also have a family member with the condition. Other factors associated with the development or worsening of restless leg syndrome include chronic diseases such as kidney failure, diabetes, Parkinson's disease, and peripheral neuropathy. There's also a strong link between RLS and certain mental health conditions, like attention deficit hyperactivity disorder, or ADHD. Certain medications can also exacerbate symptoms. Pregnancy, particularly in the last trimester, can bring on or worsen RLS, but symptoms usually disappear after delivery. Now let's talk about treatments. Lifestyle changes can often help to alleviate symptoms. Regular, moderate exercise may help, along with limiting caffeine and alcohol. Good sleep habits are key. That means trying to go to bed and get up at the same time every day and ensuring that your sleep environment is comfortable and conducive to rest. Some people find relief with certain types of medication, but it's important to note that what works for one person may not work for another. In more severe cases, doctors may suggest medications that increase the level of dopamine in the brain. If you think you might have restless leg syndrome, it's important to seek medical advice. A healthcare professional can help determine whether you have RLS and guide you to appropriate treatments. Remember, you don't have to live with sleepless nights. Help is available. Narcolepsy is a neurological disorder that affects your ability to wake and sleep. Now, let's delve deeper. People with narcolepsy experience extreme daytime sleepiness and sudden episodes of sleep, often at inappropriate times. It's like your body's switch between sleep and wakefulness is a bit faulty. The primary symptoms include cataplexy, a sudden loss of muscle tone while awake, often triggered by strong emotions, sleep paralysis, a temporary inability to move or speak while falling asleep or upon waking, and hallucinations, vivid and often scary experiences that occur when falling asleep or waking up. But what causes narcolepsy? In many cases, it's due to a lack of a brain chemical called hypocretin, which plays a crucial role in regulating wakefulness and REM sleep. Factors like autoimmune disorders, family history, and certain infections can also contribute to the onset of narcolepsy. And as you might guess, narcolepsy can significantly impact one's life. It can affect school, work, relationships, and virtually every aspect of daily living. Imagine feeling constantly sleepy or falling asleep without warning. It's not just inconvenient, it's also dangerous, especially during activities like driving. Now, on to treatments. There's no cure for narcolepsy, but symptoms can be managed. Lifestyle adjustments like maintaining a regular sleep schedule, taking short naps during the day, or avoiding caffeine and alcohol can help. Prescription medications are also available, ranging from stimulants that combat daytime sleepiness to antidepressants that help control symptoms of cataplexy. In some cases, people with narcolepsy might benefit from counseling or joining a support group. It's important not to underestimate the emotional toll of living with this condition. To wrap this up, narcolepsy is a serious condition that can significantly impact your quality of life. It's important to consult with a doctor if you think you might have it. Awareness and understanding are key first steps in managing this sleep disorder. So if you or someone you know is struggling with symptoms of narcolepsy, don't hesitate to seek medical help. Sleep disorders are common and can significantly impact our quality of life. This is a reality many of us face, but it's not something we should simply accept and live with. Throughout our discussion, we've touched on 4 common sleep disorders: insomnia, sleep apnea, restless leg syndrome, and narcolepsy. Insomnia, characterized by persistent difficulty falling or staying asleep, is a condition that can leave you feeling exhausted and drained. Sleep apnea, on the other hand, is a potentially serious disorder where your breathing repeatedly stops and starts during sleep, causing disruptive snoring, gasping for air, and daytime fatigue. Then we have restless leg syndrome, a neurological disorder that gives you an uncontrollable urge to move your legs, especially when resting or sleeping. And finally, narcolepsy, a neurological condition that affects your brain's ability to regulate the normal sleep-wake cycle, leading to sudden bouts of sleep, excessive daytime sleepiness, and even hallucinations. Each of these disorders, left unchecked, can greatly affect your overall health and daily productivity. It's crucial to understand that these are not just inconveniences or annoyances, they're legitimate medical issues that require attention and treatment. If you're experiencing symptoms that align with any of these disorders, or if you're simply not getting the quality sleep you need, don't hesitate to seek professional medical advice. Because remember, a good night's sleep is not a luxury, it's a necessity. If you're struggling with sleep, don't hesitate to seek help.